Late 80s, the chances of you dying from HIV were very good. And I guess the New York State Department of Health contacted the borough presidents and asked them what are they doing about this thing called HIV.
ACQC was formed in response to the need to understand and to help people who were affected, infected, frightened by the scare of AIDS.
So they rented a space in Richmond Hill above a hardware store. But the neighbors didn't like the fact that ACQC was in the neighborhood.
And were, I would say, chased out of there because the community did not want them there. I don't know whether it was fear of the illness or some kind of prejudice, I don't know. But things have a way of working out, and ACQC wound up on Queens Boulevard. At the beginning, because there was very little treatment and very little ways to stop the progression of the illness, when people came to ACQC, they came for help, but help in the services because they couldn't work anymore, help in what do I do, how do I plan out my life, how do I keep going. And ACQC was here for people, and sadly, in the majority, we were walking people to helping them towards the end of their life, versus now where it's all about life and living and moving forward.
ACQC provides comprehensive services to people living with HIV/AIDS in the borough of Queens, including case management, education and prevention services, mental health, harm reduction, legal services, food pantry, and also we have extensive housing services as well. You know, the case management services, the backbone of the programs, because they coordinate all of the services for the client.
Sometimes there are people that need many different needs, housing, medical care, but they don't know where to go or what to do. So case management helps them to kind of navigate some resources and link them to the services that they need.
You know, there's clients that come into us that are transitionally housed. They're coming in, they're homeless, they're being referred to our Jamaica Y. In the middle of winter, they're coming in with flip-flops on their feet. They don't have a coat, they don't have shoes. So we try to, as an organization, make every need available to them. We connect them. So they're there transitionally, which means they could be there 3 months, they could be there 6 months, but we're finding them permanent housing for them to move into from their stay at the Jamaica Y.
Sometimes when people are newly diagnosed, that they think that their life is going to be over, or, you know, how did I get myself in this situation? And we just open them up and just lead them to the resources and help them and let them know that they can still live.
Our education department, it's a prevention education department, and we pretty much do HIV testing throughout Queens, STI testing throughout Queens, and Hep C testing throughout Queens. We provide group work. We do a lot around LGBT issues, MSMs, which is men who have sex with men, and communities of color throughout Queens. We're in the bars, we're in the colleges, we're in the churches throughout Queens.
The youth program is a two-part program. We have the adolescent LGBT piece of it, and we have the all-inclusive, which all young people are welcome to be a part of it. And we have group discussions, or plan a trip to go away, or do a retreat event, or just plan a neighborhood outreach. The big thing is to get everybody tested, make them aware of condoms and condom use to make sure they're playing safe, and to protect them and give them a safe place to be and come in and have discussion, get tested, whatever they want.
It was like just necessary to learn safer sex, to learn about yourself, being just existing, and how hard it is out there as a youth, especially not having certain questions that you really need to know the answer to. You found it here, you know what I'm saying? So this was a great place, you know.
Syringe exchange programs give sterilized syringes to participants, and also safe disposal of the used syringes. It doesn't increase crime, it doesn't increase drug use, And it's actually prevent people, you know. We provide, this is a gateway of drug treatment, you know, and prevention, and HIV and hepatitis C prevention.
It took us 10 years to get a syringe exchange. And then when you start to evaluate how well the exchange was doing in reducing the spread of HIV, it was so remarkable.
Even if, you know, to get into treatment, even if they relapse and they try it again, we always meet them what they're at, you know? Like, no matter how many times they try to get into treatment, we do it for them. We're hoping every time, you know, this time they can make it. Well, then we never close their doors, you know? We never close our doors and say, oh, we did it for 20 times and you're still not making it. We do it the 22, the 23, the 24.
We run a pantry here on Tuesdays and Wednesdays.
We had a line this morning. It was almost like 1,000 people outside waiting to get food.
And you should see the people that are on that line, just giving them a pantry bag just brings joy to them, to their faces. I mean, it's little things like that that just touch your heart.
Because of our affiliation now with AHF, we now have medical and pharmacy services on site as well.
With the AIDS Healthcare Foundation being here on site has really, we work in conjunction with each other, so clients have the opportunity to make choices as to where they'd like to get their medical care, but we coordinate that service for them. When people are adequately housed, are seeing a doctor, and are taking medications, and they're able to adhere to their treatment, they're feeling a lot better and they're able to function in society a lot better.
I really think that this is the model of the future, and we have it now. Everyone says they have a one-stop shopping model, but we really do at ACQC.
You know, when you come into ACQC from the front reception desk to any service you have within the organization, we're all ready to help. We all wear different hats here.
I love the people here. We have been like a family. We've gone through a lot of personal things together.
ACQC is a place, it's in the schools, and it's a family, it's a friends, and ACQC is everything that this population have.
When I went there to ACQC in Fort Rock, it was like a family.
ACQC, as for me, is like, I say, a church. I can come there and talk to about personal problems and anything that's going on. They're here to help me. If they can't, believe me, they'll try to find some places for you to go so you can get help.
And they went that extra mile just for me, because at that time I had used up all my savings. I was broke, let me tell you, stone broke. And they were able to get me into housing where my rent was paid, and I would be able to get food from their pantry here. Now I'm running in the pantry.
They make you feel like you belong to society. They make you feel like you are the person that is everything.
I'd just like to say thank you to ACQC for all the years that I've been here, all the years that I continue to be here, and to each and every one that has helped